The bony pelvis is formed by 4 bones. 2 lateral, anterolateral hip bones. This is the hip bone and this is the other hip bone. We also have the sacrum posteriorly and another smaller bone which is the coccyx, which is absent in this specimen. So these 4 bones form the bony pelvis. The bony pelvis has many functions. It transmits the weight of the body from the vertebral column into the femurs. It also contains viscera, supports them and protects them, which are the pelvic viscera here. And okay. So these are the functions of the bony pelvis. It also offers site of attachment for the muscles of the lower trunk and also of the lower limb. The lower pelvis, we said, is composed of 2 hip bones, the 2 hip bones and sacrum and coccyx. The 2 hip bones form the anterolateral. If you look at it like this is the anterolateral wall of the bony pelvis, when they articulate with each other anteriorly at the symphysis of pubis. This is the symphysis of pubis. Posteriorly, the 2 hip bones articulate with the lateral aspect of the sacrum. This is the sacrum bone. They articulate at the sacroiliac joint. This is the sacroiliac joint, and the other one is here, deeper inside, below this ligament. Okay, so these are the sacroiliac joints, the articulation. Okay, the hip bone is an irregular bone. It is formed by 3 subunits, 3 bones. At childhood, they are separate bones, and they meet at the acetabulum. This deep depression is the acetabulum. They meet here by a cartilage known as a triradiate cartilage. The 3 bones are superiorly we have the ilium, which is the largest bone. Anteriorly and inferiorly we have the pubis. This is the pubis bone. Inferiorly and posteriorly we have the ischium. This is the ischium bone. Okay, if you look at it from here, it's easier to notice. This is the ilium. Okay, until here, this is the ilium. This is the pubis, and this is the ischium. Okay, the deep depression on the outer surface of the hip bone is the acetabulum, which articulates with the hemispherical head of the femur to form the hip joint. Okay, posterior to it, or let us say behind it, we have the greater sciatic notch. This is the greater sciatic notch, which is separated from the lesser sciatic notch by the ischial spine. This is the spine of the ischium. We said this is the ischium and this is its spine. These 2 notches are converted by 2 ligaments, which are the sacrotuberous ligament and the sacrospinous ligament, into foramina. This is the greater sciatic foramina and this is the lesser sciatic foramina. These 2 ligaments, the sacrotuberous ligament, it is a strong ligament that arises from the lateral aspect of the sacrum, also from the coccyx and the posterior superior iliac spine, and it's inserted to the ischial tuberosity. While the sacrospinous ligament from the lateral aspect of the sacrum and coccyx into the ischial spine. We said this is the ischial spine, so it's attached here. Okay, these convert these 2 notches into foramina, greater and lesser sciatic foramina. About the ilium bone, it is a flat bone which has iliac crest between the anterior superior and posterior superior iliac spines. This is the anterior superior iliac spine, and this is the posterior superior iliac spine. Below these 2 spines we have the respectively the anterior inferior iliac spine and the posterior inferior iliac spines. Okay, so these are the spines. Internally we have a line which is known as the iliopectineal line that runs inferiorly forward and downward, so inferiorly and anteriorly on the inner surface of the ilium. This is the ilium on the inner surface of the ilium. It forms a part of a structure known as the pelvic rim. The pelvic rim divides the pelvis into 2 cavities. The pelvic rim starts from the first sacral vertebra. The first sacral vertebra anteriorly and upward, it bulges forward, forming the sacral promontory. Here, this structure is the sacral promontory. You see, this is the 5th number vertebrae, and this is the first sacral vertebra. It has bulged anteriorly, so this is the sacral promontory. This forms the posterior margin of the pelvic rim. Then laterally, we have the iliopectineal line, and then anteriorly, we have the symphysis of pubis. This is known as the pelvic rim, which divides the pelvis into 2 compartments. Upper is the false pelvis, and lower is the true pelvis. Now we said this is the ilium. Then we have the pubis. The pubis, this is the body of the pubis. It has a body. It has a superior ramus. This is the superior ramus, and this is the inferior ramus, which joins the ramus of the ischial ramus. Okay. It also, on the body of the pubis, we have the pubic crest. This is the pubic crest on each side. And then we have the pubic tubercle. This is the pubic tubercle. The 2 pubic bones are joined together anteriorly by the symphysis of pubis, which is immobile joint. Okay, so this is about the pubis. The ischium is found, we said, posteriorly and inferiorly. This is the ischium. This is the ischium. It has a body and it has a ramus. The ramus of the ischium with the inferior ramus of the pubis, they form the ischio-pubic ramus. This is the ischio-pubic ramus. They both enclose this circle, this opening, which is the obturator foramen. Okay, this is the obturator foramen, which is covered almost completely by a membrane, fibrous membrane, which is the obturator membrane, allowing a small area of passageway of the obturator nerve and some vessels from the pelvis into the thigh. This is the obturator canal, through which vessels and nerves pass from the thigh into the lower limb. Okay, so this is about the ischium and the pubis. Okay. Now we said the pelvis is divided by the pelvic frame into two compartments. Above it is the false pelvis. The false pelvis is clinically not so important because it's considered to be continuation of the abdominal cavity because it is bounded posteriorly by the lumbar vertebrae and not by the sacral vertebrae, and by the iliac fossae and the iliacus muscles on each side, and anteriorly is bounded by the abdominal wall. So it's considered a part of the abdomen. So it protects the abdominal viscera. Also after third month of pregnancy, it supports the gravid uterus, and in the early stages of labor, it helps guide the fetus from the false pelvis into the true pelvis, which is here. Okay. Below it, below the pelvic rim, we said we have the true pelvis. The true pelvis is composed of three parts. The inlet, which is the same as the pelvic rim, the same thing. Then you have the cavity, then you have the outlet. The cavity is between the inlet and the outlet, and it has a shallow anterior wall and a deeper posterior wall. If you look at here, it is shallow, but here it's deep. So the posterior wall of the cavity is deep. The outlet is found in the inferior part. It is bounded posteriorly by the coccyx bone. Its continuation is like this small triangular bone, and laterally by the ischial tuberosities. This is the ischial tuberosity here, and also the sacrotuberous ligament. This is the sacrotuberous ligament, and more laterally by the ischial spine. Anteriorly, it is bounded by the pubic arc. This is the pubic arc. The pubic arc is between the ischio-pubic rami. Okay, so this is the arc, pubic arc. So this is the outlet. In between them, we have the cavity, which includes the viscera. Okay. So this is about the true pelvis. Now we have the sacrum. The sacrum bone is composed of 5 rudimentary vertebrae. Rudimentary, that means they are not anymore vertebrae. They have fused together to form a single bone, which is wedge-shaped with a forward concavity. This is the anterior surface and this is the posterior surface. So if you notice, it has a forward concavity. Okay, so it's convex posteriorly. It has a base, which is the larger part, which articulates with the 5th lumbar vertebrae, and it has a narrower inferior border, which articulates with the coccyx bone, which is here. Okay, the vertebral canal of the 5 vertebrae fuse together to form this canal, which is known as the spinal canal. The spinal canal contains the coccygeal, sacral, and the lumbar nerves, anterior and posterior roots. Also contains the phylum termini. The phylum termini is the terminal part of the spinal cord that runs here. It also contains some fibrofatty material and the subarachnoid space as far as the level of the 2nd sacral vertebrae. Okay, so this is about this canal. It ends by this hiatus known as the sacral hiatus, which is formed due to the lamellae of the 5th and sometimes of the 4th sacral vertebrae do not meet at the same line, so they form this hiatus, which is an opening known as the sacral hiatus. Anteriorly and posteriorly on each side we have 4 foramina. See this 4 foramina and this 4 foramina for the anterior and posterior rami of the upper 4 sacral nerves. And the sacrum is wider in proportion than its length in the female than in the male. Okay, and it forms an angle with the 5th lumbar vertebrae, as you can see this angle, which is known as the lumbosacral angle, because it bulges forward. You see it comes like this, the 5th lumbar vertebra, and then the 1st lumbar sacral vertebra bulges forward, so it forms this angle, which is known as the lumbosacral angle. Okay, this is about the sacrum. Then we have the coccyx, which is not present here. It is small triangular bone. It descends like this. Its apex is attached to the inferior border of the sacrum, and its inferior border is narrow inferior border is loose. It is composed of 4 vertebrae, which has fused together, and a small triangular bone. And the coccyx, which is here, articulates All the coccyx vertebrae have only bodies. It is not found here. It should be here. They have only bodies and no transverse processes, except for the first coccygeal vertebra, which have rudimentary transverse process and cornua. Cornua are the remnants of the superior articular facet and the pedicles, which articulates here with the sacrum. So if we can go to another specimen, we can see the coccygeal bone. It should be here. And these are the lateral masses of the sacrum, or also known as the sacral ala, okay, sacral ala. They articulate with the lumbar vertebrae, okay. And these are the superior articular facets of the first sacral vertebra, and this is the spinous processes fused together to form one single bone process. These are the spinous processes, and we said this is the hiatus, sacral hiatus, and this is the sacral canal.